So one of the most common things that we do is see people for one tooth extraction. And this is something that we may see them impromptu that day when they've been to their dentist and they have declared that that tooth is no longer viable, or the person may have broken it over the weekend or haven't known about it for a while. So it really kind of depends on how they present as to how we take care of them after the procedure. But usually what we'll tell them is, number one, we have printed documents that we want you to read over and follow. My staff always goes over post-operative instructions, as do I. We try not to overlap and confuse people because some people are very, A, B, and C, and we want to make sure that we accommodate that person. And other people are more used to more of a loose guidelines for it, so they like to hear what each one of us tells them about it. Now, as far as specifics, the extraction site usually needs to be just left alone for the first 3 or 4 days. Hygiene around the area, but not that particular area. First couple of hours after the procedure, there may be some gauze involved, depending on how much bleeding we anticipate with it, and that also depends on what medicines the patient's on and what level of anxiety that patient might be experiencing. Not every patient has to have antibiotics after they've had an extraction. Even though the mouth is terribly dirty, studies don't indicate that everyone needs one. But in the event that they do, we provide for that, and they usually have about a 10-day to 14-day course of an antibiotic in those cases. I would say if you have a problem with a tooth, see your general dentist and determine whether or not that tooth can be saved. If it can't be saved, then more than likely you're going to be seeing us.